Welcome back here, and listen to this. More than 1 in 3 American adults, or 88 million Americans, has pre-diabetes, but more than 84% of them don't even know they have it, and it's a pretty scary stat there. Director of CDC's Division of Diabetes Translation, Dr. Christopher Holliday, and Dr. Gerald Harmon, President of American Medical Association, join us this morning. Gentlemen, thanks so much for being here. Really appreciate your time.
Good morning.
Thank you for having us.
Yes, tell us about this new campaign and why it's important for people to know if they have pre-diabetes. Let's start with you, Dr. Holliday.
Yes, thank you. The new campaign is a collaboration between the CDC, the AMA, and the Ad Council. And we're launching a new series of public service announcements designed to help people learn their risk of prediabetes. And this is part of our Do I Have Prediabetes campaign.
Amazing numbers. 1 in 3 American adults. Wow. Dr. Harmon, how does someone know if they're pre-diabetic, and why is it important for them to know that?
Well, it's interesting. The scary thing is you say 84% don't know they have it. One of the reasons they don't know is there's no symptom. You just have to identify your risk factors. You have to be 40 or older. You have to be sedentary in your lifestyle, not getting enough activity. You have to have a family member, a mother, father, sister, brother with active diabetes, with a diagnosis of diabetes, or you need to be overweight or obese, or the rare occasion you might have been a pregnant mom with gestational diabetes. So we ask that you test yourself, go online. The Ad Council, the CDC, and the AMA have a doyouhaveprediabetes.org website. You go, you take a simple questionnaire, you answer those risk factor questions. If you're identified as having very high risk for prediabetes, talk to your doctor, get a blood test.
So does this tool, when you talk about sedentary people that, aren't getting enough exercise, boy, you talk to people sometimes, doctor, and they think they're doing enough. Does this tool kind of actually walk you through whether you really are being active enough?
Yes, the risk test actually, because of the risk factors that Dr. Harmon mentions, really prompts us to want to know our status around prediabetes. But it's just modest lifestyle changes that can reverse prediabetes. It can be reversed, and you can change the outcome. You don't have to progress to type 2 diabetes. And those modest lifestyle changes are just moving more, taking the stairs versus taking an elevator. It doesn't mean a gym membership. Could mean gardening, could be long walks. So we're encouraging people to move more and to eat better and to lessen stress. And those are factors that could help prevent progression to type 2 diabetes.
Dr. Harmon, what are some of the biggest health concerns that come with type 2 diabetes? I mean, if pre-diabetes goes undiagnosed here, people don't do anything about it, what should they be concerned about?
If they become a type 2 diabetic, with the natural progression is higher risk of stroke, of heart attacks, of other chronic illnesses, kidney disease. Diabetes is a very serious illness. If you have pre-diabetes, you can prevent and reverse that and not go on to type 2 diabetes. That's an incredible asset. You actually have control. You can put the rabbit back in the hole. We don't get that opportunity very often.
Yeah, Dr. Holliday, talk a bit about the racial disparities when it comes to pre-diabetes. Can you tell us why that is and what can be done to increase access to care?
Yes, as we know, there are disproportionate impacts of chronic diseases for low-income communities, communities of color, or other marginalized groups. And so the COVID pandemic is one example that has heightened those disparities, and it is actually a more severe call to action when you have a chronic illness like type 2 diabetes. And so we're encouraging people to take this simple 1-minute risk test to determine if they're at high risk for type 2 diabetes or have prediabetes. And they would do that at the website, the campaign website, doihaveprediabetes.org, to know their risk and to take action.
That leads me to my next question, Dr. Harmon. Does being pre-diabetic make a person more susceptible to COVID-19?
Well, the risk factors of having prediabetes, the obesity, the age, and the lack of activity, the sedentary lifestyle, are risk factors for COVID-19. We know that. I can tell you personally, taking care of patients, they're relatively young. They're mid-40s. Their only real apparent risk factor was obesity, sedentary lifestyle. Absolutely, that puts you at risk.
All right, Dr. Holliday, we'll end it with you. Where can people learn more? I know you mentioned doihaveprediabetes.org is a good site. Any other recommendations where people can go to keep themselves and their family healthy?
Yeah, absolutely. I'd just like to repeat, go to doihaveprediabetes.org, take the simple 1-minute risk test, know your status, and be able to take action. And if after you've determined that you're at high risk for type 2 diabetes or have prediabetes, talk to your doctor. A simple blood test can reveal whether you have prediabetes. And if you do, there are lifestyle change programs that you can participate in that are part of the CDC-led National Diabetes Prevention Program. You go to that site, put in your zip code, and you can find a program near you and begin to make lifelong changes like improving your nutrition, moving more, and reducing your stress.
Doctors Holliday and Harmon, thanks so much for helping us help our viewers stay healthy. We really appreciate your time here this morning.
Thank you.
Thank you for having us.